Welcome to the Ty Beal Show, where we discuss food, science, and life. I'm Ty Beal, a scientist at the Global Alliance for Improved Nutrition, or GAIN. My guest today is Dr. Emily Deans, a board-certified psychiatrist who has practiced in Massachusetts for over 20 years. She taught at Harvard Medical School from 2004 to 2021, was chief resident at Brigham and Women's Hospital, and was a Boston Magazine peer-awarded top doctor from 2016 to 2025. She's a pioneer in nutritional psychiatry and the creator of the popular Evolutionary Psychiatry blog at Psychology Today. In our conversation, we discuss how what we eat affects how we think and feel, the gut-brain connection, which nutrients matter most for mental health, and practical advice for anyone wanting to improve their brain health through diet. A quick note before we start. This podcast is separate from my role at GAIN. Okay, let's dive in. Dr. Emily Deans, it's really nice to see you face to face. Welcome to the show.
Hi, good to see you.
I followed your work.
And I yours, so it's always good to talk when people are interested in the same weird stuff that you're interested in.
I know. That's why I started this podcast, partly is because I just wanted to talk to people that I've interacted with, and it's a nice excuse to have a conversation face to face as opposed to just through social media or over email. So really happy to have you here. You have a really, I think, what used to be quite niche perspective of kind of linking nutrition to psychiatry. You started this Evolutionary Psychiatry blog back when very few psychiatrists were thinking about nutrition. So I'd love to hear what first got you interested in this and how diet affects mental health.
Yeah, so I graduated my training in psychiatry in 2004. And that's, you do college, then you do medical school, and then you do a separate residency in psychiatry here in the United States. So, and at that time, we were learning a lot about the limitations of a lot of our medications, because it's sort of in the 90s, everyone was thinking, oh, we're just going to find medicines for everything and we're going to cure psychiatry. But it turns out that, medications can be super helpful, but it's one piece of, and a lot of times it's sort of tweaking things in the brain with a sledgehammer when you really need a screwdriver. And they don't really understand how a lot of them work. And then a lot of things came out about how studies where the medications weren't effective had not been published. And so we had sort of a little bit of a biased view of how well that the medications worked. And then the other aspect of psychiatry at the time was therapy. And the therapy is wonderful and it can be very effective, but it certainly misses some things as well. And so I was looking for, okay, well, what are alternative ways to help people besides, in addition to therapy and medications, and how can we really see what we're missing? And a lot of that stuff is alternative medicine, lifestyle stuff. And a lot of when you read books about it, and then you look up the sites and the books to see where they reach their conclusions from, you realize that a lot of it's just quackery nonsense. And so when I was trying to say, okay, well, why don't I kind of look at these? I'm in a position where I have a little bit of time and I have access to, medical libraries. Why don't I look up some of these studies and just see how good they are and see what you can derive? And I did this in the framework of evolution, knowing that we had evolved on this planet with a certain type of lifestyle, how many generations, thousands of generations as hunter-gatherers, and 500 generations in agriculture, and just a couple generations is digital, 5 to 20 in industrial, and then 1 to 2 in digital. Mm-hmm. And how is that affecting our brains that were mostly evolved for hunter-gatherers? I didn't want it to be a naturalistic fallacy, throw the baby out with the bathwater things. Antibiotics are good, vaccines are good. I know we can get a hotly divided political debate on that kind of thing nowadays, but flying is a great invention, even though it can screw you up because of the time zone changes, are too drastic and not anything that our brains sort of evolved to handle. Um, so I was really just trying to look at nutrition as being a big change from how we mostly evolved, and what we knew about that and what the studies were and how it affected the brain and how it affected mood.
Yeah.
So
It's kind of like a lot of these for I don't technological advances were double-edged swords in many ways, and we can kind of get into that. I think, a lot of people who hear about evolutionary something think with nutrition at least paleo diet. So what is that? Is there any sort of link with the paleo diet here, or is this just evolutionary in a different sort of framing of the diets we evolved to eat?
yeah, I became very interested in the paleo diet because I didn't feel that either. Again, if you remember back to the 90s, you had this, and it still continues to this day, this sort of fight between the low fat, uh, sort of vegan, fruitarian kind of crowd versus the low carb. Started with Atkins, now it's kind of became sort of low carb paleo slash carnivore. I never thought any of that made a lot of sense. We're omnivores. We've lived all over all over the planet and have evolved to eat actually a very wide variety of foods with wide variations, in the amount of fat and the amount of carbs. And even reading those big seminal books at the time, Good Calories, Bad Calories was the first. The second half of it never made any sense to me, and paleo made more sense as sort of, again, a framework to begin. But you can't do the naturalistic fallacy. I mean, we eat grains, we eat legumes, and data since then has come out that people seem to be a lot healthier eating fiber, and so I was interested in the paleo diet. It actually worked quite well for me as well, and I noticed some changes in my hair and my skin that seemed better, on sort of a more paleo style diet. But I always felt that it was more about getting rid of processed food, highly ultra processed food, highly modern foods, rather than it was any change in, your carbs or your fat or whatever it is. And most of the data in psychiatry, because the Mediterranean diet is really considered sort of like the heart healthy, safest, healthiest diet. Most of our studies that we've done in psychiatry have used that, not the paleo diet.
Right.
So that's kind of, where the data is.
Okay. Well, let's get into this into the science. The gut, brain, inflammation, all of these issues are kind of hot topics. And when you think about the brain as being this very energy hungry organ, even more than the heart, what does that really mean practically for how diet affects our mood and our cognition?
Yeah, so it has I mean, I think everyone's experienced this. Your diet has a profound effect on your on your mood and your cognition. If you skip breakfast or you're hangry or whatever it is, it can affect it almost instantly. Um, and certainly, again, your brain uses about 20% of the glucose energy of your body, and it's only to 2 to 5% of our total body mass. So it really is an outsized, power hungry organ, literally. And um, variations in things, even like the amount of phosphocreatine in our blood, can affect your cognition, and affect your mood almost immediately. If you take a drink and you deprive it of certain amino acids and drink it, you can affect someone's mood immediately. You can take all the serotonin out of a drink, and serotonin depletes someone, and they can become basically angry and either suicidal or otherwise violent, have tendencies that way, and it goes away when you replace the serotonin. They're not the tryptophan, which is the precursor of serotonin. And so we know all of these things. It doesn't mean that a lack of serotonin is what causes depression. That's complicated. It's a type of brain inflammation and a change in the way your body processes and your brain processes tryptophan, which changes. It's also complicated, and almost the more we know, the more we don't know. Certainly, that's true of the microbiome. And there are these interactions between the gut and the brain. also affect mood, and it goes the other direction as well. Everyone's been nervous and suddenly felt like, oh, your stomach's doing a little tumble, or maybe you have to run to the bathroom before a presentation, for
Mhm.
example. So it's definitely all connected, and having enough of the right kind of nutrients is super important for the brain to work properly. It's also important if you're on medications. Uh, they're not going to work if you don't have the enough zinc or magnesium or iron. It doesn't matter what you're taking.
Mm.
So we discovered that when, you have people with eating disorders, medications don't help eating disorders until you replete the calories.
Wow.
Um, so it's,
Calories and nutrients, which
yes.
we can get into as well. It sounds like
Yep.
the nutrient density also matters, and especially with any disordered eating where people are under consuming calories, you're also probably very likely to be lacking in nutrients as well.
Yeah. I mean, one of those aspects of that, I'm blanking on the name of the study, but it was run amongst the conscientious objectors in World War II, where they deliberately starved them of 25% of their body weight.
Hmm.
And what you don't hear a ton is that um, those guys went crazy. Like two or three of them ended up in the psych hospital. One of them cut off some of his fingers.
Wow.
So, um, that they don't talk about that so much when you look back at, because people weren't necessarily focused on those kinds of side effects, but it did make you never want to go on like an 800 calorie a day diet um, until you're starving.
Oh,
Um,
gosh.
and how much of that was from deliberately starving? These were normal weight young men.
Hmm.
And how much of that is from nutrient deficiencies that developed over the months that they did the experiment? I don't really know, but
It's a
it
good thing we don't allow those types of experiments to pass the ethical review boards today.
yeah, that
Wow.
would have been a tough one. Yeah.
Gosh. So, you mentioned we don't know a lot, and kind of the more we scratch the surface of knowledge in this area, we realize how much we don't know. Can you explain a little bit about what we do know about the gut brain axis, or how does the gut communicate with the brain? What's going
So
on there?
the gut and the brain communicate directly via the vagus nerve, indirectly via hormonal changes, and the microbiome can affect changes in the microbiome can affect all sorts of interesting things in your body. Like they've discovered your liver and your bile duct release certain types of bile acids that help you digest, and when you change the microbiome, it actually signals the liver to make different kinds of bile acids. So they go from producing one variation of them to other variations of them, and we're not really entirely sure how that communication happens. um, so, but you could see why something like that would evolve, because microbiome is telling you about kind of what you're eating, and maybe you need different types of bile acids to digest things more efficiently. Um, and some of those signals that go back and forth are endocrine signals, cortisol and hormonal changes, and those can affect mood and the brain as well. Um,
One thing
and
I'm curious about, I oftentimes I'll be just sitting there, not really in the mood for vegetables, but I'll just have myself start eating them, carrots or cucumbers, something just raw. And I notice after I have a few of them, I feel like I just want them more. Like I get this sort of signal to keep eating these. And I have two daughters who are ages 5 and 8. And I notice the same thing with them. If you just hand them a carrot or a cucumber and they start eating it, if they're distracted, they'll just keep eating it out of the bowl. And you kind of get this feeling that there's something going on with the gut telling the brain or something, this is good. I want more of this. Keep feeding me.
yeah, same thing happens with potato chips too. um, but yeah, no,
But
I've
you
noticed
feel, but the difference is
you don't
there.
feel good eating the
I
potato chips.
feel
Yeah,
better after eating the carrots and the cucumbers, and I
yeah,
don't feel better usually. I feel very temporarily better after the potato chips, but that fades quickly.
yeah. No, I think that's true. And yeah, I have two daughters myself, so they're a bit older. But that's certainly that was the part of the point of putting out the carrot sticks and the celery sticks with every because they would eat that instead of the other garbage. Um,
Right.
I don't, I'm not aware of, is there sort of a fiber signal that, that fiber, and I sort of can, uh, I feel like the joy that I get in eating carrots or celery has to do sometimes with there's a certain type of hydration you get from it.
Yeah, the
They're
water
kind
content
of
itself.
watery, crunchy. That's kind of
Yeah.
fun.
Hmm.
And so I wonder if that's an aspect to it. Um, but
Yeah.
you know, I mean, we can go over a little bit sort of what we know about kind of food and mood and the history of those studies, if that interests you or.
Yeah, I would love to know a little bit more because I think a lot of my knowledge is a bit experiential, um, and briefly scanning the literature, but understanding, I think, how what we eat affects our mood would be helpful. And even if you want to get into some of the areas around inflammation, depression, all
Yeah.
of that stuff.
So a lot of our early studies of nutrition and mood were massive failures because usually they focused on one thing, like, oh, vitamin K or vitamin E, or, does
Like
sugar
a
make you
single
hyperactive? Yeah,
single nutrient. Yeah.
exactly. And, it's really complicated, and nutrients don't work by themselves. Zinc and copper kind of balance each other, for example, and
Mhm.
changing one without the other, you know, might cause a problem. Uh, and so they moved on from these single nutrient studies, but they weren't studying full dietary changes and psych originally. They were always studying cardiology usually or
Mhm.
diabetes, right?
Mhm.
Um, and so they started with these whole of diet interventions and these huge trials of thousands of people who were usually this is a Mediterranean diet. They would compare cohorts. Usually they would tell people what to eat. The people who ate mostly sort of more the Western diet would be like in one extreme, and the people who ate mostly like the Mediterranean diet would be in the other extreme. And then they would have when people filled out their surveys of what they were actually eating, which that has its own problems. And then along this, when they're studying how many heart attacks they have, how many people die of this, how many people die of that, a lot of them were also giving out scale ratings of depression ratings. And you would find that the people who are eating the healthiest, closest to the Mediterranean diet, also had a less uh, scales of depression over a period of years, for example.
Mhm.
The interesting finding in that in all of those whole of diet studies, the ones that completely avoided red meat had no effect on depression. It didn't make it worse, but it didn't make it better. The ones that added like a little bit of red meat, uh, some of those actually had a beneficial help on depression. And that's why when they finally did a whole of diet change study, Felice Jacka did this in Australia. Um, uh, and it was actually for depression. So it was people who have been diagnosed with major depressive disorder in a psychiatric interview, not just filling out scales about how they were feeling.
Mhm.
And she did a modified Mediterranean diet, which was mostly Mediterranean diet with red meat a couple times a week. And she compared it to people who weren't eating just whatever. She compared it to people who were eating pretty unhealthy. Um, the people who changed the Mediterranean diet and the people in the control were eating a Western a Western diet. She didn't take someone
Got
who
it.
was eating, salads and chicken breast and,
Mhm.
fiber one in the morning or whatever it was.
Right.
But they found that the effects on the mood of these people with major depressive disorders was comparable to medication. After
Wow.
6 weeks, 3 months on the modified Mediterranean diet, there was another study that was done in Finland. Um, that the results weren't quite as powerful, but again, it didn't hurt, and there was some benefit. And then um, Felice Straka also found out, we always hear, oh, it's so expensive to eat healthy, but she found that the people on the modified Mediterranean diet actually spent, I don't know, something like $21, and this was Australian money, $21 less a week eating on the modified Mediterranean diet, probably because they were cooking at home more and not ordering takeout and whatever.
Mhm.
And so that was kind of the first one. She followed up with um, with some other studies following the size of people's hippocampus, which is a part of the brain that is affected by trauma. So if you have trauma when you're young, your hippocampus tends to be smaller when you're older. And it's also just over time, our hippocampus shrinks. It's also the center of memory. So if you're not able to name, oh, that actor, Meg Ryan was married to Dennis Quaid, and you can't remember what movie they were first in together, when that would have been on the tip of your tongue when you were younger.
Mm-hmm.
It's your hippocampus is probably losing a little bit of cells as we get older. And so she discovered that people who ate more, a healthier cohort, actually have larger hippocampi than people who don't. It's you still shrink over time, but you start from a larger amount.
Mm-hmm.
You always have to worry with all of these things about kind of correlations when you're looking at just kind of populations. That people who tend to eat healthier are probably, they're more educated. They might start from a better place. They may have had a better example growing up. Parents who cared about what they ate, for example, instead of just giving them, Cheetos and whatever to eat. And they kept those habits throughout the year. So there are multiple reasons besides eating healthy why they might have a different brain than somebody else.
Right.
And so we've followed this, not with a lot. There's some studies of things like ketogenic diets and schizophrenia. They're very, very tiny. Most of them are really pilots. There's some, so that's kind of all we have. And that really, honestly, Felice Jacka basically started in the nutritional psychiatry of the modern better studies back in 2009, 2008. So it's now that's been, 15, 16, 17 years. But when I first started, I started blogging, I think, in 2008, 2009. So
Mm-hmm.
I was looking at the study and like, wow, and since then there's been a lot more interest. There are a lot more studies of things and certain supplements, and done in kind of a smarter way than just, giving people a ton of vitamin E. And so we do know a lot more about some supplements and mental health. The most interesting work recently, honestly, has been in creatine, and that might be another reason why, our major dietary source of creatine is usually skeletal muscle. So that might be a reason why taking the meat entirely out of a Mediterranean diet, the red meat, can seems to negatively affect, or negatively, again, it doesn't make people more depressed, but it doesn't help with depression.
Yeah. I think that's fascinating to hear the sort of nuance about red meat, because red meat is often sort of correlated with negative health outcomes in many observational studies. And what you're highlighting is that for depression and potentially mental health, red meat may actually contribute to positive mental health or cognition or brain function. Maybe it's a combination of these nutrients. There is this sort of meat factor, it's hypothesized, but creatine being a key component, and then nutrients. Maybe there's the certain nutrients like B12 or iron. If you're deficient or low in those nutrients, perhaps that getting a little bit of that meat could play a role. Is actually beneficial, right?
Yeah, and I think what people tend to avoid when they go along the more vegetarian, especially vegan, route, are a lot of foods that contain B12, zinc, creatine,
Mm-hmm.
um, uh, omega-3 fatty acids. All these are very, very important in the brain. And so, again, if someone wants to be vegan for whatever reason, and then they come in and tell me, oh, it's really important for me to remain vegan, it's not my job to talk them out of it, but we will talk about, okay, what can we supplement just to make sure that you're not missing out on these brain nutrients.
Mm-hmm.
And, and there's a kind of a religious quality about some, same on the other side, on sort of the carnivore side. And so they sort of feel, oh, well, just because I'm carnivore, because I don't need vitamin C, because you only need vitamin C to metabolize glucose. And I was like, fine, okay, whatever, but your
Pretty
gums are
extreme.
rotting. So,
Yeah. Pretty
um,
extreme diets.
yeah,
Yeah.
and so I'm just sort of, okay, what can we do you need to do what you need to do with your life and what's important for you, but what can we just do to make sure that it's not causing any deleterious effects? And if we have to supplement or do whatever that is, that's fine, you know?
Yeah.
Um, and when you ask more about sort of inflammation, I tend to think inflammation is one piece, but it tends to be such a amorphous piece, and everything is inflammation. Um, Inflammation is an evolved piece of our physiology, like every other piece of our physiology, and we'd be dead without it. It's really important when it's out of
Hmm.
control and when it's chronic, because you're putting chronic stressors on your thing, or you're chronically infected with something or whatever's going on. Then it can be a problem. In psychiatry, we tend to think of these as more psychological stressors. There's certainly physical stressors can cause psychologic issues, because you just don't see. You could see, oh, if I have cancer, my body's fading away, I clearly very ill, my mood isn't good. All of those things are very connected. You don't see it on a person when someone is in an incredibly stressful personal situation, and
Yeah.
they're not physically ill, but they still have inflammation in their brains. Um, and but again, you can kind of get on the woo side of quackery if you say, "Oh, I'm going to make you, take away all the inflammation and make sure that you're sleeping well, eating well," and all that's true. Sleeping well, eating well, exercise, all of that should decrease your overall kind of inflammation in your body and chronic and mindfulness can help with chronic stress and things like that. Uh, but it can be also seen as a panacea to everything, and not everything gets better with just a good diet and sleeping well. And it's gonna help,
Hmm.
but unless you go, again, a lot of people take this and go off the deep end and get really prescribed about what they eat, and really prescribed about, oh, I won't go see a movie or go visit my family because I'll be home after 10, and then I'll miss my bedtime that I have to have every night, or and that it
Hmm.
can be its own form of sort of obsessive compulsive disorder, or compulsive living that doesn't make people happy necessarily.
Hmm.
So
Yeah.
it's all about balance and wisdom and common sense, which we seem to lack sometimes.
The common sense is really important. I think somehow sometimes that gets lost. One of the things that I think is really common in the food space is the targeting of specific foods as being inflammatory, when it really seems like, from my understanding, the overall diet has a big impact on that, right? But like people are saying, you need to eat these specific foods that won't cause inflammation and these foods that will cause inflammation. And then the other piece that I hear a lot too is like this, how do you support your mitochondria, which is, I think, a really big buzzword. But I'd love to hear your perspective on this. Is there, how much of this is hype versus reality in these discussions that are taking place, usually in the health kind of influencer space?
Yeah. So your first question was, oh yeah, are foods inflammatory or not? What's interesting about that is that for some people, certain foods are very inflammatory. If you're allergic to it, you're creating
Exactly.
a direct inflammatory response.
Yeah.
Um, but from a sort of a population perspective, and certainly people need to know if that's happening. But from a population perspective, you're absolutely right. It seems to be that overall, in a diet of, I tend to call it like frosting and savory frosting. So basically, you're talking about, highly processed foods with lots of sugar, or highly processed foods that have lots of processed grains and fat. All the stuff that you can eat a ton of, even if you've just had Thanksgiving dinner, you can eat more of it, like pie and chips and French fries and things that, you can eat when you're totally stuffed full. That's probably
Yeah.
the
My
stuff,
my daughter says she has an extra tummy for dessert.
an extra
Like she
dessert
could be
stomach.
full for full for dinner, but there's always room for dessert. The only time that I can remember her being full for even dessert was over this Thanksgiving. She said, I can't even eat dessert right now. And so we had to wait like a few minutes before we brought out the pie.
And that's the stuff we just seem to be able to overeat. And then the whole process of metabolic syndrome, I think we've discovered this more and more, especially over the last 10 years. It's not necessarily about carbs or fat. It's often a combination, but then eating so that you have excess energy. And of course, we've evolved to be able to kind of err on the side of excess energy, because if we evolved the other direction, we would slowly starve to death and kind of not notice. So
Hmm.
we overcompensate, and that's why kind of with our modern diet, we're in food, atmosphere, there may be some other aspects like estrogens in the water or whatever, I don't know, but just our diet, uh, that we have, Kevin Klatt did that study where they found that people who are eating ultra processed foods tend to eat like 800 more calories a day. And
Yeah. Yeah. Kevin Hall did that study in 2019, and there's been some follow up studies too. Exactly.
yeah,
Yeah.
Kevin Hall is what I meant, not Klatt. That's somebody else. Um, and that excess energy that you're dealing with, you you stuff it into fat cells, and then your fat cells become overcompensated, and then eventually you get, your insulin, you become insulin resistant, and these fat cells in your liver, and then you start spilling energy into your blood, which is when you become diabetic, right? So it's that excess energy,
Hmm.
and there's all sorts of other, it leads to high triglycerides and hypertension and fatty liver, and all of these things come together, and depression and actually uh, anxiety are both associated also with metabolic syndrome. So, and it's sort of a double-sided arrow too, meaning if you're more depressed, you're more likely to have metabolic syndrome. If you have metabolic syndrome, you're also more likely to have depression, for example.
They could
Um,
both cause the the other condition.
yeah, it's they're correlated, which is one aspect of it, but they also is this sort of bidirectional arrow where when you sort of look at it from each side, they tend to make the other worse.
Hmm.
And it doesn't help that psychiatric medications, for example, have a tendency to have help people gain weight, which can be very helpful if someone's very ill and they're not eating, but it's not particularly helpful if you already have somebody with metabolic syndrome. And,
Hmm.
uh, you know, so um, does that sort of address the
Hmm. The first
inflammation
part.
side of it? But
Yeah.
the mitochondrial side is also very interesting, because certainly what we find with things like dementia, and also what you can see in someone who's deeply depressed, and you look at, functional MRIs or SPECT scans or brains, you can see changes in metabolism in your brain. This is all relatively new, 20 to 30-year-old um, data that we have, because prior to that, you couldn't really monitor the brain while you were using it. You could evaluate the brain afterward,
Hmm.
but it wasn't working very well. Or you could sometimes, stick a probe in your brain, or, on mice, you could carve their poor little skulls off and maybe get some energetics. But now we have a much better idea of kind of the parts of the brains that we use, and we can do things with big magnets that can stimulate parts of the brains and make them kind of function again. And that's really, really, really interesting for resistant depression, PTSD, et cetera, et cetera. But can you do anything like that with diet? Can you improve um, the metabolics in the brain so that the frontal lobe controls a lot of uh, how much executive function we have? So how do we prioritize? Can we get stuff done? Are we effective as human beings? Um, and are we productive? And how we feel about that. And frontal lobe is impaired in depression. It's impaired in kind of the opposite way in bipolar disorder. It's impaired when you're manic. It's impaired in ADHD, certainly, sort of chronically. And that's why, when you get deeply depressed or very, very anxious, you sort of develop symptoms like ADHD. It's because it's affecting the same part of the brain. It's not that you've suddenly have ADHD. Um, but when you're very anxious, for example, it's harder for you to concentrate. It's harder for you to get stuff done, and harder for you to be effective. But the right amount of anxiety actually helps you get things done and be effective, because, you would never pay your rent if you were never anxious about it.
You need
Um,
some. Yeah.
so the, so part of the process of this, and what we know is impaired in the brain, and and when I say hypometabolism of the brain, not only is it communication in the brain, so from one area telling the other, hey, get online, or this is happening over here. There's also the energetics of the brain, and we know that they're impaired in things like schizophrenia, lifelong. We know in dementia, the energetics of the brain are very impaired, so that you just can't utilize the energy in your brain as efficiently. That seems to be falling apart. And that's where the interest about ketogenic diets come in, because ketogenic diet, if you're ketogenic diets won't necessarily help the rest of your body, because you try to get your blood, you make sugar in your liver. It's called gluconeogenesis. And so you can't, humans in particular, cannot get blood sugar very low in the body. It doesn't really go below, 70 or 80, how we would measure it. And if it does, you feel very sick. You can't function at all. And that's kind of an emergency. And so your brain and body does everything it can and will cannibalize your muscle and things to make glucose if you drop your blood sugar too low. In the brain, however, you can live, some of your cells in the brain can live just on ketones, which is a metabolic energy byproduct of eating fat, right? And so most metabolically healthy people go into ketosis, several times a day, probably not deep ketosis, especially overnight when you haven't eaten for a while. And your brain can utilize ketones, and ketones can be a little bit more of an efficient means of energy than glucose. So you produce maybe fewer radical oxygen species. It bypasses one of the sections of the mitochondria. So possibly impaired mitochondria might be able to use ketones in a more effective way in the brain. And so that's a question. Okay, if someone goes on a ketogenic diet, can it help their depression? Can it help schizophrenia in particular? Because ketogenic diets, or bipolar disorder, because ketogenic diets are also anti-seizure, and anti-seizure medications are used all the time in bipolar disorder. And the ones that work in bipolar disorder affect kind of the brain chemistry in a similar way to a ketogenic diet. There are other anti-seizure medications that don't work in bipolar disorder, and they do not have the same mechanism of action as a ketogenic diet. The actual mechanism is still a bit mysterious, but that's why you'll hear someone like Chris Palmer say, oh, we're making the mitochondria, more efficient with the ketogenic diet. Maybe that's part of it. And it certainly, anecdotally, I've, met plenty of people who control their depression with a ketogenic diet, for example, or control, sometimes some people control bipolar with a ketogenic diet. They're using that pharmacologically, though. They're not just eating a diet that's compatible, and it's unlike a diet or where, you have a cheat day on Saturday. If you're using a ketogenic diet as a pharmacologic intervention, you can't cheat. You can.
It's very strict. You have to remain very strict.
Yeah, you have to remain pretty strict. And you have to be, some people seem to, whatever the kind of ketogenic diet they eat. And there's Ethan Weiss up in San Francisco, he's a cardiologist, and he's done studies of more sort of like a Mediterranean style ketogenic diet. That keeps popping up. And he found that their blood chemistry, their LDL and all those things didn't worsen. In fact, some of them got better. Other people, in my experience, it's mostly people who sort of are running around drinking heavy cream and eating a ton of saturated fat. Some people tolerate it very badly, and they can, it can, in worst cases, it can cause things like pancreatitis and people develop cardiovascular disease and rapid worsening of atherosclerosis and calcium scores and things like that. And so if you're going to try that, you really have to be working with your physician and tracking your lipid levels and things like that. And so, but it's another thing, some people, they don't want to be on medications. And if this works, great. There's not a ton of data about it, and certainly nothing in wide studies. And I've seen plenty of people, who might have bipolar or schizophrenia. It doesn't matter much what they eat. They feel better in general when they're eating, healthier, or they're losing weight, or they, feel better about themselves, et cetera, et cetera. But it doesn't seem to acutely affect how psychotic they are, how, with whether their moods are going up and down. Whereas other people, it can actually have a profound effect. So I think there's just a lot we don't understand about that as well, which I'll keep saying because it keeps being true.
Yeah, what works for one person isn't necessarily going to work for the next. You also, I had Ethan Weiss on the show as well. So, listeners can go and check out that episode, which was great. You highlighted something I think that's really important for the general population. When we're in our modern food environment, we're often eating constantly, often snacking. And what you said is that typically, you might go into ketosis, kind of light ketosis a few times a day, definitely overnight. And if you're snacking and just eating around the clock, you don't really have that opportunity as much. And so there is kind of potentially an argument to be made for spacing out meals a bit and just making sure to have a nice gap overnight. Do you kind of for that reason suggest people really have about 12 hours of fasting from overnight, or do you think that's not particularly important?
Um, I think it depends on the person. This is so highly individual, and a lot of people, it's more of a psychologic thing. I've met people who are afraid to be hungry.
Mm,
Um, a good friend of mine, for example, had celiac, and so she was always hungry. They didn't diagnose it for a long, long time, and so she was always hungry and always sick, and hates being hungry because it just reminds her of this, her history growing up when people didn't know what was wrong. Um,
right.
and so her differences for eating and snacking are different than somebody who's just, oh, it's around, I've got my bag of chips, so it's 4 o'clock, I'm cranky, I got to drive home, so my blood sugar's feeling low from the crappy lunch that I had. And so I gotta eat a Snickers bar before I hop on the road. So you can definitely feed into these kind of blood sugar cycles if you're not eating carefully. But the personally, and this is it's probably woo myself. I tend to be sort of like a more circadian driven person. It seems that most of the data, I can say that there's a solid amount of data that probably um, the worst meal to skip is breakfast.
Right.
But that said, I've met a ton of people. They'll drink a cup of coffee and they don't eat until noon and they're fine. But overall, people who eat breakfast are healthier and happier. and
Mm,
and so and then a lot of people, they eat way late at night, and then when you eat at night, the physical aspects, of close to bed, it can affect, if you ate something that doesn't agree with you, all of a sudden you can't sleep because your stomach is rolling over. If you eat a lot of carbs right before bed, you can kind of give yourself a blood sugar crash in the middle of the night, so you can wake up kind of sweaty and anxious. um, and so for those reasons, and also what I think historically what we evolved for, and there's some, you know, um, calories proper. William, I'm suddenly blanking on his last name. He is
is it
really into
Legos?
yeah, yeah, yeah.
Yeah.
He's really into sort of circadian rhythms, and I think he's done an extra postdoc on circadian biology. So he's an expert in it, if anybody is. And he came across this sort of idea and has found some studies that does show that if it's dark, maybe you shouldn't be eating very much.
Hmm.
Um, so, have your first meal at sunrise and then have your last meal at sunset. Now, you could see, we have a video talking to each other, and I know that this is just an audio podcast, but it is 1:49 where I am, and Ty can see that the light is already slanting a lot in my
Mm-hmm.
room where I am, because I'm up in Boston, and it's December, and so it might not be practical if you have to work until 5. Our sun is already down here,
Right.
so. But I do try, as a general rule of thumb, not eating too close to bed, not drinking alcohol too close to bed, I think can be very beneficial for not only sleep, but also maybe beneficial also for calories. That also avoids when people get fat, and when you talk to them, or when medications make people fat, what changes is that they get carb cravings at night. And by carb cravings, I mean, fatty, snacky carbs like chips,
Mm-hmm.
or sugar candy, those kinds of things at night. So you're eating basically ultra processed grains and sugar at night with,
Mm-hmm.
and that's people say, oh, seed oils are bad. Seed oils are very interesting because almost all the overall population data of how many seed oils you consume, it's associated with better health if you consume more. And yet
Mm-hmm.
seed oils are such a marker of ultra processed food that I always say, how is that possible that
Mm-hmm.
they go hand in hand? And the only thing you can really withdraw from that is that seed oils are either neutral or probably cardioprotective. So, I tend to avoid seed oils just because I try to avoid too much ultra processed food in general. But
Mm-hmm.
on its own, I don't think you need to run screaming if you have, salad dressing that has sunflower oil in it.
Right.
Um,
Yeah. It
so,
could be the ultra processed foods that are causing the issues. Right.
yeah, yeah.
More
So,
likely.
um, but it's seed oils is what they put in Fritos and, and other things that you probably
Mm-hmm.
shouldn't be consuming at 8 p.m. while you're watching, the newest Stranger season of Stranger Things or whatever.
Yeah.
Um, so, so that to answer your question in a very long, involved way is that I tend to think that we should eat more sort of during the waking hours. While obviously you're always eating while you're awake, but um, unless you have some people wake up in the middle of the night and don't remember it and they consume a whole thing of ice cream and stuff like that. But anyway, beyond that, what makes when people start gaining weight, they'll notice that they're eating more, particularly at night after dinner, for example. And that's when people tend to, we tend to not gain weight slowly. We tend to gain weight actually, usually mostly October through January in the year. And people will tend to gain weight, 20 pounds pretty rapidly and then stay on a plateau for a long time, then maybe gain another 20 pounds pretty rapidly. So that's what makes it's not when people say, oh, to lose weight, you just have to consume 100 less calories a day. That's only one Oreo. So just eat one, or, and that's just not how human beings work. So,
Mm-hmm.
um,
In the real
uh,
world.
but if you tell people not, some people can behaviorally manage and maintain their weight just by not eating at night, you know?
Right. Right. Okay. So we've talked a lot about research, about some of the kind of discussion that happens in the space of nutrition on blogs and social media and whatnot. I'm really interested to hear your experience in the clinical realm when you have patients. How, you know, how often do you include some aspects of diet or nutrition in your treatment? Do you ask people what they eat, what their diets are like? Is that a part of it routine, or is it only in certain cases?
So eating and feeding and what you eat and when you eat and how you eat and where you eat and who you eat with is a huge part of the human experience. So as a psychiatrist, I'm really interested in knowing about kind of your full human experience, sex, drugs, rock and roll.
Mm-hmm.
What's do you like your boss? Do you like your husband or your wife? How are your kids? Are they healthy, et cetera, et cetera? Are your parents healthy? So part of my nosy interactions with people is asking, okay, what do you typically eat? Tell me about your breakfast, lunch and dinner. Like, what'd you eat this morning? And that will give you, and then people will start to talk about their experience. So maybe they're vegetarian because, of their religion, or maybe they're, like Orthodox Greek and they're vegan for a large part of the year or whatever it is. Or maybe they just were really interested in animal welfare. And so they don't want to eat animals. Or a lot of people have weird textural issues. So they hate vegetables or they hate, meat.
Mm-hmm.
Because they just don't like the feel of eating, a piece of chicken, which is fine. People are very different. And so
Right.
understanding what their limitations are and what they eat. Some people are pretty adventurous. Some people eat the same thing day in, day out. Some people have, financial concerns, so they can't have this amount. Some people, have an eating disorder, so they're very limited in what they will eat. And so just asking about that will tell you a lot about someone's experience and their lives. And that's just really important for me to know as a psychiatrist. So it is part of my everyday questions about people. That said, there are people who are very, very interested in changing their diet, and there are other people who have no interest in changing their diet whatsoever. And so that's where you kind of meet somebody where you are. And maybe there's something that you can adjust that might make them feel a little bit better. Maybe they never eat any fish. They hate fish. Well, we can experiment with eating maybe different types of fish every once in a while just to kind of broaden their palate, or introduce some more omega-3s to their diet, or, adding a couple of sardines to a tuna fish sandwich, to get a little more omega-3 in there, and you
Mhm.
probably won't notice. And I talked to somebody today who's trying to widen their palate, and we talked about, instead of using like flour and meatballs, using like cut up little bits of zucchini squash in tiny little pieces, and you can make like,
Mhm.
I like the texture of those meatballs actually better than ones made with flour or cornflakes or whatever. And this is, someone who's maybe avoiding vegetables altogether. You can do this with your kids too. This is how I used to sneak sardines to my kids. I used to sneak
Mhm.
vegetables to my kid and meatballs. Um, so those are the kinds of little things that I do as a psychiatrist. As an MD, I'm not trained. I'm not an RD. So I'm not trained to design a full diet for somebody and say, these are the meals that you should eat, and this will be 1,200 calories and whatever it is.
Right.
And this will have your whole balance thing. But as a psychiatrist, and just with common sense, you can work with someone to kind of widen their palate, or if there's something that they're completely avoiding that may be affecting their health, find a way around it, or find a way to just kind of eat, again, less ultra processed food and more natural food. And some people are very, very interested in that. And some people can have real health benefits from it. Um, and certainly if people are successful at losing weight and feeling better and less, their mood, that's the two fastest way to help somebody is to get rid of their constipation, or,
Mhm.
um, and then help them lose weight. And then, often their mood and every other things in their life improve drastically. And of course, now we have these new tools, which I don't prescribe because they're not FDA approved for psychiatric indications, but I certainly have lots and lots of patients who are on the GLP-1s, and it's
Mhm.
very interesting. Most of them are happier. They don't have the food noise anymore. They're not obsessed. They're less impulsive. There's lots of data now that it decreases things like drinking, which, I think is a
Mhm.
big problem for mood. And, that's why when people talk about, oh, you can't eat a potato, it's inflammatory, or whatever the bugaboo of the week is. Like, what we're really missing is like smoking and drinking and sleep and sitting
Mhm.
around eating chips all the time, watching you know political news or something all day long. Of course you're going to be unhappy and feel terrible and look terrible.
Yeah.
So some of those more obvious things you also have to pull back. And certainly I just think it's fascinating that something that helps appetite in general, or sort of appetites for living, the GLP-1 seems to reduce that impulsivity, and then also and reduce the just that appetite for more. And so they pull back not only from eating too many processed foods, but also pull back from things like smoking uh, and alcohol in particular. So
Right.
it's just
Fascinating. It's not
yeah.
just about controlling the food intake, but it's other behaviors that are often maybe unhealthy, or things that people can tend to obsess over or do compulsively. Um, you mentioned a few nutrients like omega 3s, some foods like sardines. Do you have a list of sort of any of your go-to brain foods that you recommend for people to prioritize, just for general mental health and well-being?
So often the thing that's missing in the diet is seafood, some sort of seafood.
Mm.
And again, you're never going to get everybody to eat salmon or whatever. So we'll try to focus on that, or supplement omega-3s if they won't do any. Um, the other, people who eat a lot of processed food tend to be low on potassium, magnesium. People who, when we stress, we waste zinc and magnesium, and people who often have anxiety and depression are often very, very stressed a lot of the time. That's how they ended up
Mhm.
with anxiety and depression. And so often focusing on seafood, actually, mussels, nuts, and things like that have lots of zinc and lots of nutrients in them. So you can tell someone to, carefully because of the calories, but to have, if they're hungry at night, instead of going for the bag of Doritos or whatever it is. Doritos taste great, don't get me wrong. but you shouldn't be eating a bag of them every night, probably. Maybe to have a little small packet of nuts instead, or shell some pistachios, things like that.
Hmm.
In order, just because you'll have, it's just more nutrient rich, but it'll still give you that crunch and that kind of snack
Right.
feeling. And so really trading things. So I really love to go to McDonald's and get well, how about maybe some dark chocolate, like a square of dark chocolate to give you that sweet tooth, right after dinner or whatever, instead of McDonald's ice cream every single night, so that's how I
Hmm.
tend to work with people, is kind of on an individual thing, assessing maybe some absences that they have and trying to substitute kind of more nutrient rich foods so that you get your bang for your buck and but still get some of that pleasure that you're missing.
Makes a lot of sense to make these like sensible swaps to help people, because I think for many people trying to transform their entire diet is going to be really challenging, right? You got to start somewhere. Focus on the biggest wins. You've also written about how estrogen appears to protect women from psychosis, and how menopause creates a second risk window for psychosis. Can you
Yeah,
tell us a little bit about?
hardly
Yeah,
seems fair. um
yeah. Why is that? Why that doesn't feel fair at all? But is there, this connection between hormones and mental health that we need to understand as well?
yeah, this is a really interesting question because they've come up with new medications now that are partially benzodiazepines, which are um, anxiety reducers, like Klonopin, Ativan, Xanax. So these new medicines, but they also are parts like associated with progesterone, and they tend to help people with postpartum depression. Right now it's an infusion that's something like $30,000, and you have to be in the hospital. So it's not like I'm going to have an outpatient who has mild postpartum depression. They're not going to, insurance would never pay for them. They're just going to say, put them on Zoloft. Um,
Right.
but it certainly just show that you can really quickly get somebody better. You know, Partly it's the anxiolytic part of this sort of benzodiazepine, but also there's a hormonal aspect to it of after having a baby, and there's huge hormonal shifts after you have a baby. Um, so that's a time when women are very, very vulnerable to psychiatric issues, whether it be anxiety, depression, it's variations of bipolar disorder. Also, uh, pregnancy, weirdly enough, is kind of anti-inflammatory because your immune system is suppressed because it doesn't want to make you you don't want to be rejecting the baby that you're trying to make that's a little bit immune different from you because it's partly you and partly the father's.
Mhm.
So after you have a baby, your immune system bounces back. And so you tend to so people who have autoimmune disorders, it's often they don't have symptoms of it during pregnancy, but it bounces back with a vengeance after they have the baby. And that autoimmune disorders are also associated with psychiatric issues. Um, and so you also will see changes, just in the regular process of having a period. In that process, you'll have a couple of weeks where your progesterone is high and then your progesterone drops. And then people have the withdrawal bleed. And it's right before the progesterone, your premenstrual dysphoria is probably associated with progesterone interfering a little bit with our metabolizing tryptophan into serotonin. And low serotonin doesn't cause depression, it causes suicidality and violence. And
Wow.
if you've ever had PMS, you might know what that feels like a little bit. But the spiking and going back of hormones during a cycle can definitely cause psychiatric effects. And some of these can be ameliorated. Maybe if you add a little bit of extra serotonin prior to your, tryptophan prior to your period, or a lot of people find the stress of this, you waste your magnesium. So if you add magnesium supplementation, it can decrease period symptoms, decrease headaches, things like that. Um, so there are ways that you can just, again, by listening to somebody really closely what they're experiencing, you can kind of adjust here and there. Sometimes with supplements, sometimes people are more interested in, okay, what in the diet is high in magnesium? And you can kind of say, okay, what do we like? What are these foods? Show them that list. Um, and you can make some nice adjustments in people's life without having to, start them on Zoloft for PMS.
So in these kind of critical stages, I'm thinking postpartum, perimenopause, are there certain things to look out for people? I mean, if you're going through something, whether it's a depression or other mental health issue where you're not yourself, or you have certain tendencies that are not normal to you, how can how can you sort of be aware of those, and where do you go to get help? Do you go to a psychiatrist? How do you talk to the psychiatrist if you do go?
Yeah. So what I find if in these kind of first episode psychosis, so all these things happen, autism tends to develop in early childhood or you're born with it. Schizophrenia tends to develop in young men in like the late teens to 25. In young women, it's more like 22 to 35. Um, in and then you have the second spike around menopause of risk for developing women for developing schizophrenia or bipolar disorder, which it's a terrifying thing. You've been totally normal with no mood problems your whole life, and then all of a sudden, mom is like, not sleeping and is running around, bought a new car, and is starting to sing out in public and try to direct traffic, and you're sort of like, my God, what's happening here? Um, and a lot of what you'll notice at first is perturbations in sleep when it's really scary. And if you're not sleeping for several days, and some of this can happen just from if you've just had a newborn, you're not sleeping very well. And some of it is an early manifestation of like a postpartum psychosis or postpartum mania. And then things rapidly get out of hand from then. So often in that case, you send somebody emergency to the emergency room so that they can be evaluated immediately. If it's a lesser, not an extreme emergency where you're not sleeping and you're suddenly, think you're possessed by demons or think that you are the new pope or that you're blessed by God and you can heal people with water that you've touched or whatever, common
Mm-hmm.
things that people have in these situations. Then if it's not something that urgent, then you can go to your primary care doctor, talk to them. They can probably refer you. A lot of people can get better with therapy, and just taking care of themselves really well, making sure in the postpartum case that you have somebody else, maybe a night nurse, or, if you can afford it, or a family member come in and be able to take care of the baby so that you can get some sleep. And then, in menopause, making sure that you're sleeping, maybe address medications on a different level just to make sure that you're getting back on track with that, make sure you're eating okay. So I would go to probably the primary care if you don't already have a psychiatrist, and they can get you in touch with somebody in your area who's good, hopefully.
What about hormone replacement therapy or any type of hormones? Do you have any guidance around when that may be appropriate or helpful to consider?
Yeah, so hormone replacement therapy got a bad name for a long time because it was people were keeping women on it, until they were 90 and things like that. And if you keep people on it too long, there are higher rates of heart disease, maybe associated with cancers, things like that. However, if you're having symptoms, hot flashes, sleep deprivation, irritability, mood swings, people around perimenopause and menopause, people tend to do really, really well. And there's probably lower incidence of things like cardiovascular problems and people who are getting hormone replacement therapy. Some people have very strong ideas about bioidentical hormones or that, I haven't looked terribly closely at that literature, so I can't give you guidance on that. Most people do fine with like an estrogen patch and all. um,
Mm-hmm.
and I've seen people whose mood and irritability and everything gets a lot better, and particularly because their sleep gets better. Um, and so it's very safe for, you know, probably for the kind of 10 years around menopause, but people shouldn't be on hormone replacement therapy until they're 90.
Okay.
Um,
So it's a temporary thing for a few years, potentially, and speak with your doctor about it. But it's good to know that there are options. That I think that's the main thing, is like realizing and recognizing it doesn't necessarily have to be like this. There are ways to treat this. It can feel discouraging sometimes if your primary care doctor doesn't really have a good sense on what to do about it.
yeah, and
Um,
some of them tend to be really biased in not. I know people always complain that doctors are always pushing pills and always giving too much medical intervention, but I think there's also a bias of, oh, everyone has to go through that, just get over it, or whatever it is, and not really maybe haven't been up on the literature or up on having experienced it themselves and they were fine or whatever it is, or not knowing someone who is really, really, really massively affecting their quality of life. So then, you've got to kind of shop around or insist with your doctor, not that all doctors take that well, but kind of insist, no, my sister tried it, I want to try it, or, whatever it is. And it's not something that's an outrageous ask usually for hormone replacement around perimenopause symptoms. So, if your doctor won't listen to you about it, then go to your OB. They're probably, your OBGYN, they'll probably listen to you about it. And in men, testosterone, there's a really interesting dichotomy in kind of the bro manosphere health space, very pro testosterone and giving people testosterone and prescribing testosterone, the hims and the hers, you can go to online, you can get it prescribed online, versus, some of the data showing that, it's actually associated with a lot of worse health outcomes, testosterone replacement therapy. So there, again, the needle and the sort of, I guess, traditional medicine side kind of, it was towards testosterone therapy and then swung against. And I think there's probably a middle ground there. Certainly it's kind of the Wild West out there in the online medicine space. And now people are getting peptides from China and mixing them with bacteriostatic water and giving themselves tans and all sorts of stuff, which sounds very not something that I'd be interested in experimenting and injecting into my body. But, some people are made happy by that. But I think they're cutting down on some of these Chinese peptides being shipped into the country, though I'm not sure exactly how you could do that. But there's all sorts of amazing things that they're discovering about different hormones and different stages of life for men and for women.
Yeah, I think the important thing is to be aware that there are options and you can bring it up with your doctor, right? And if they're not really open to it, you can look for a new one. So I've taken up a lot of your time, Dr. Emily Deans. I really appreciate you speaking with me today.
Thanks for having me on. Yeah, I hadn't realized we'd gone over our hour. But thank you. I hope what I've said has been helpful for someone or gets them interested in thinking about things, and continue doing your good work that you're doing.